Hello and welcome to the Mental Health Innovation Challenge information session. My name is Nick Stevens and I'm a program manager from the University of Newcastle, and I'm your host for today's session. I would like to take this opportunity to say that some of the following conversations may lead to discussions about mental health and suicide, and that if you or a friend are seeking support, please phone Lifeline on 131114. First thing I would like to say as part of the Zoom webinar is that this is an information session. That means we want to know your questions. So please have a look at the FAQs on our website. And if that does not answer your question, please type them into the Q&A chat. How can you access the website? My colleague Taylor will post the link into the chat. I would also like to acknowledge and respect the Pambalong clan of the Wabakal people, traditional custodians of the land on which the campus of the University of Newcastle is situated, and also acknowledge and pay my respects to other Aboriginal and Torres Strait Islander nations from which our students, staff, and community are drawn. We also pay our respects to Aboriginal and Torres Strait Islander nations from which you are based. I'd now like to introduce Richard Nankervis, who is the CEO of the Hunter, New England, and Central Coast Primary Health Network. Richard, thank you very much for joining me.
Thanks for having me, Nick.
Okay, so firstly, Richard, what is the Hunter, New England, and Central Coast Primary Health Network, and what does it do?
Well, first thing to say is that we're a not-for-profit organisation that's funded by the federal government in Australia, and our work is predominantly to commission services across our region, and in doing that, try to improve access to primary health services and help to improve those services as well.
So then for the Primary Health Network, what exactly does innovation mean?
I think for us as a primary health network, innovation is a key part of what we need to do to affect change at a program and system level. And part of the reason for that is that we're seeing growing health needs and gaps across our region and limited resources really to tackle them in healthcare. So we're having to really try ourselves to continue to innovate, but also support innovation across the region. And for us, innovation can mean a range of things. It might mean big systemic change, but it can also mean stepwise change that can have a significant impact for people and communities in our region. So it can be a range of different things.
And who can participate in the Mental Health Innovation Challenge?
Well, for this challenge, we're looking for really a community-based approach. So what I mean by that is we want to encourage service providers in primary care, GPs, allied health, nurses, other services, but also we want to involve people with a lived experience of mental illness and caregivers as well. So we're looking for that key collaboration, but more than that, we're looking to engage and involve technology, innovators, developers, entrepreneurs in that to really try to foster more of a collaborative and cross-sector approach to innovation. And finally, the other thing to say is that we would really encourage students and researchers to be involved as well, because we want to test new things and evaluate them.
And so, for example, what would a successful innovation look like within the Mental Health Innovation Challenge?
Well, first thing from an innovation perspective is the journey, I think, and it's bringing people together. So bringing key people together, building that innovation, trying to build, say, an environment or culture of innovation. Over the past few years in primary healthcare, we've seen incredible innovation, incredible take-up of telehealth, for example, and we've emerged from a pandemic from a generational increase, but we've also been a bit isolated in many respects. So actually bringing networks of people together, building those networks, re-engaging in some of that collaborative development is what we'd really like to see. The other thing to say is from a solution perspective, there's no one size fits all. It might be a new service, it might be a new process. There are a whole range of types of innovations that we might see come through this challenge, and we're really open to that. We'd really like to see how we can tackle the challenge of mental health and early intervention in a range of ways, I think.
It's a fantastic challenge with lots of events that we'll go into detail soon. Do you have any final remarks for all the audience watching?
I would say that if you're watching this video, whether you're watching it now live or you're watching a recording, if this is of interest, we just encourage you to be involved, participate, come to some of the pre-events as well and get a sense of what the collaboration and innovation might involve. And I think it's something new and different, and being a part of it, I think everyone will get something out of, including us as a PHN. So I'll just encourage that. Thanks, Nick.
No worries. Thank you very much, Richard Nankervis, the CEO of the Hunter New England and Central Coast Primary Health Network. Thank you very much. Just in regards to a little bit of background story about why I'm here in particular, the PHN has partnered with the University of Newcastle and the University of New England and the broader community to deliver the Mental Health Innovation Challenge. So Richard touched on briefly why the PHN are running this challenge, but the core objectives are to seek new and innovative early intervention solutions that empower individuals to do three things. The first is identify a decline in mental fitness and therefore a need for intervention. The second being ensuring the early adoption of the proposed solution to achieve or maintain mental fitness. And the third is for the solution to be adaptable, accessible, and scalable. And the idea for this challenge is to have a ripple effect of innovative networks, enterprise skills, and awareness of mental fitness across the PHN. Please note that a solution is not intended to replace traditional therapy. So why is there a focus on mental fitness as our chosen problem landscape? Well, the research shows that mental fitness within our community is trending downward, which then adds pressure to stretch mental health services and staff. For instance, 42.9% of people aged 16 to 85 years had experienced a mental health disorder in their life. And such a broad, complex problem requires collaboration and teamwork across multiple disciplines. So this challenge is for health professionals, from GPs to allied health workers, community workers and health service providers, to people with lived experience and caregivers, to innovative technology providers, entrepreneurs and business professionals, as well as students and researchers. There are three key ways to get involved, and they include expert panel sessions, the Ideas Collider, and finally, the Mental Health Challenge itself. I'll start with the expert panel sessions. These QR codes you can scan to sign up for these different sessions. But we are holding two within the John Hunter Hospital on Tamworth on Tuesday the 13th and Thursday the 15th, respectively. This is where you can learn from industry experts who are actively dealing with and solving these problems across the Hunter, New England and Central Coast regions. And these events are both from 6 to 8 p.m. and involve a panel with Q&A, followed by networking and catering afterwards. And they are next week, so you can sign up using these links. Otherwise, Taylor will provide those links within the chat. Next up are the Idea Colliders. So we have three held across each region. There's one in Tamworth at UNE's Smart Region Incubator on Thursday, 22nd of February. There's one at the John Hunter Hospital in Newcastle on the 27th of February. And finally, one at the Health and Wellbeing Living Lab in Gosford on the Wednesday, 28th of February. All sessions are from 6 to 8 p.m. At the Idea Collider, you can expect to meet like-minded people and practice the problem-solving process with a problem specific to the area. There will also be networking opportunities and catering provided. Once again, Taylor will provide a link to these events within the chat. Finally, we have the Innovation Challenge itself, held across two intensive days on Friday the 15th and Saturday the 16th of March at the John Hunter Hospital. This is the final event where you'll meet other health professionals, industry experts, entrepreneurs, and many others to work in teams to create a scalable, innovative solution. It is important to note that as part of the key terms and conditions of the challenge, that one member must live or work in the Hunter, New England Central Coast region. Please also note that the selected participants from the New England region will have their accommodation and transport costs to Newcastle covered under the challenge, as arranged by the University of New England at their Tamworth Idea Collider. What you can expect on the Friday night of the challenge day, beginning at 5 p.m, is largely registration and team formation for the challenge. This expert panel session is simply for participants to hear from experts within the industry who are either actively solving or being challenged by the problem statement and their experiences. This is followed by some more event information and logistics, then a dinner and networking opportunity. After dinner, participants will be invited to form interdisciplinary teams where individuals can come up and present to the room their ideals and skill sets that they are seeking to partner with. This is all to aid team formation. After the teams have successfully formed, we will then invite and organize participants into relevant Slack and DevPost channels so that their work can be monitored and uploaded to the relevant channels. At 10 p.m. on the Friday, the venue will close. For day 2, on Saturday, the 16th of March, the Health Innovation Living Lab will open at 7 a.m. and the challenge officially commences. This is where the teams are working away, developing their solution to the given problem statement. During this time, mentors who are experts in mental health or design thinking and entrepreneurship will visit the Health Innovation Living Lab, and you can ask them your questions as you are proceeding through the challenge. We have breakfast and lunch scheduled for 8 a.m. and 1 p.m. respectively. And the challenge officially closes at 4 p.m. It is important to note that all projects will be submitted to the GitHub account by 4 p.m. on Saturday, and failure to submit will result in disqualification. Okay, so what is GitHub? That is something that we will explain on the Friday beforehand. The pitches will commence at 5 p.m., where each team will present their solution to a panel of judges. The pitch will be 5 minutes maximum, and we prefer if 1 to 2 members pitch only. The following criteria will be key to judging: innovation, solution fit, feasibility, prototype, and finally pitch. At 6 p.m, and hopefully by the time the pitches are finished, there'll be a dinner break. At 7 p.m, the judges will present their findings and announce the winners of the challenge. The prize money is as follows: $2,000 to the first place, $1,000 to second place, and a $500 People's Choice, highly commended prize. At 8 p.m, the venue closes. After the challenge, there are many ways that you can be supported along, After the challenge, there are many opportunities to further pursue your idea at I2N. These include our pre-accelerator and our accelerator programs. And you can find more information and the application criteria on our I2N website, which Taylor will now link into the chat. If you have any further questions, please post them into the Q&A webinar chat and Taylor will respond to those. Otherwise, you are also welcome to book a consultation session with myself, where you can either explore your idea, some different feedback about the different events, or connecting to different mentors who you think might be relevant. You can use this with the calendar link that Taylor will post into the chat, and it will also be available on the website. Before we move into Q&A, I'd like you to ask you to complete this event feedback survey. This helps us run better event programs to better serve the PHN community and track participant engagement across each event within the Mental Health Innovation Challenge. Taylor will also post a link in the chat, and the survey should take less than 2 minutes to complete. It is only 3 questions. What we're going to do now is we're going to run through the Q&A that has been submitted into the webinar chat. Remember, you can also see the FAQs on our website before submitting a question. And please know that we'll update the FAQs based on the participant questions across these events. Thank you very much for attending today's session. Once again, if you or a friend are seeking support for your mental health, please call the amazing people on Lifeline on 131114. Okay, we'll jump into the Q&A. Let's have a look. The first question that has come across is from Tamara Ferris. What about people who cannot attend in person? Is there any online access to these events? That's a fantastic question. So we're having this information session, which is a webinar. But I think the main thing that we're trying to have for some of these events is in terms of the networks and connections that we're trying to build. In terms of all the announcements and the recordings of these events, all these events will be recorded. So we're able to submit those online and so people can participate. But the main thing in terms of not being able to attend in person is missing out on some of those networking opportunities, but you'll still be able to attend these online and see these sessions. Our next question comes from Mark Wallace. I see on the FAQ there's a mention of data sets. Any guidance on what data sets might be available for us to work with? That is a fantastic question, Mark. That I cannot answer right now, but I'll be able to go back and I'll update that FAQ in terms of what different types of data sets will be available for you to work with. Once again, if you have any questions on the Q&A, please type those through and we'll do our best to answer those. We'll wait for another 2 minutes to see if there are any other questions and answers. Here we go. Great challenge. Thank you very much, Basanta. Finally, is there a use of AI within the innovation challenge accepted? Of course, we're looking for a broad range of solutions. So if you can find something that's existing particularly and be able to use that, that's a fantastic idea. In fact, a couple of our entrepreneurs that we have within the I2N are specifically skilled in AI, and they'll be attending some of the challenge events as mentors. So you'll be able to ask them your questions. But AI, of course, that's a fantastic idea. And I really encourage you to come along to some of the pre-events. That way you can meet other people who are also interested in AI to pursue that solution. From Craig Brown, we have this question coming through. Is this open to ventures that are already underway? That's correct, Craig. Yes, it is. So if you already have an idea that you've presented, that's absolutely fine, or if you're an existing service provider. The main bit of feedback that we have here for you, Craig, is that judging criteria that we have. So thinking about those 5 elements that we'll be using on the Mental Health Innovation Challenge Day across the Friday and the Saturday. But great question. Thank you very much, Craig. Rachel, I think this is a similar question. I've developed innovative technology to track mental health and wellness using Apple Health data. Is this innovation network a useful way to get my ideas brought to fruition? Yeah, it's fantastic. That's actually really interesting too. So, Rachel, I think it's a great idea to come along and you'll be able to find out for yourself. So, for instance, if you've been able to track this mental health and wellness using Apple Health data, come along to some of the events and perhaps you could share some of the insights that you've been able to gain from your experiences, particularly with some of the industry experts that we have for our expert panel that starts next week. Thank you very much, Rachel. Kate, how many people would be in a team ideally? This is an interesting question because there's not a perfect answer. Generally in teams, we prefer 2 to 5 people. But what's really important in teams is the interdisciplinary nature of them. So for instance, there may be a lot of health professionals here, or there may be a lot of tech experts and entrepreneurs. And having that mix is really valuable. So having the experience of actually living with and dealing with these systems and facing this problem head on, to actually being able to create some of these solutions and ideas and be able to build those prototypes. So there's no perfect answer here, but I think from my experience, 2 to 5 would be ideally in the team, particularly for this challenge. Great question, Kate, and that's definitely one that we'll add to our FAQs. Next question comes from Rebecca. Is the prize money intended to implement the idea? It is, of course, intended to implement the idea, but in terms of the rules or the restrictions in terms of how the prize money is used, this will be allocated to the team leader, and the team leader will allocate as it's distributed, yes. So there's actually no rules behind how the prize money will be used. But yes, of course, the whole purpose of this challenge and these events is that way we can be able to create an innovative network and bring people together to be able to create some solutions. So thank you very much, Rebecca. Great question. Next one comes from Jess Wilcox. Are usability and accessibility needs being incorporated into this event? I think I might need to ask some clarifying questions there. Are we talking about different the event stages in terms of different events that we're holding, or are you talking about the actual challenge itself? Maybe perhaps we can let Jess ask another question there. I just need to clarify that part. If usability and accessibility needs are being incorporated into the event in terms of the actual challenge itself, which is a yes, but I'll probably need to expand on. So I'll just let Jess maybe clarify that one. But great question, thank you. Our next question comes from Professor Darren Morton. Will these successful initiatives be eligible for funding to implement them? Fantastic question, Darren. There's a lot of conversations that are happening about this. In terms of what we're able to promise and present right now, it's just this prize money. And there's obviously different support networks from University New England with their Smart Incubator and for University of Newcastle with their I2N. But let me flag that this is an area that has had a lot of conversations. And I expect after the challenge, we can definitely have some news about how this challenge will further continue on if there's a successful initiative from the challenge. Great question. Thank you, Darren. Our next question comes from Andrew Wilson. I have clients in the region and spend significant time there, but my office is not within the region. How is works or lives within the region defined based on registered office address? Clients spend significant time there, my office is not within. Yes, that is a fantastic question, Andrew, and it's something I won't be able to give you an answer right now. I'll have to go back and check that one with the different managers of the event. But yes, right now our criteria is, does the person live and work there? And that is a specific case that we'll come back and get you a proper answer from. So let us flag that one, Andrew, and we'll have an answer for you. We might be able to post that on the FAQs on our website. Did you say that applicants or teams must have one person who lives in the Hunter, New England area? I'm from Coffs Harbour. Yes, Julie, that's right. So we do require that one person is from the Hunter, New England area and Central Coast area. The other thing that happens too is, remember, the team formations will happen on the Friday of the challenge. So you have Friday 15th and Saturday 16th. So for instance, if you're concerned about this, you can come along to the challenge if you're from Coffs Harbour, if you're able to. And hopefully you can form some teams there with some people who have been living and working in the areas. Great question though. Our next question comes from Prem. How do you suggest entrepreneurs and investors get involved in supporting the ideas? That's a fantastic question, and that's more my background. So this is a great opportunity that the PHN is leading in terms of developing an ecosystem and a network to spark innovation within the mental health space, but broadly in the primary health network space as well. For entrepreneurs and investors, the best way to get involved is to come to one of the pre-events, because there's a couple of things that you'll get out of that pre-event. The first one is the network. You'll meet the actual people who are facing this problem in the health professions, but you'll also meet the different experts, okay, and their take on the problem as well. So meeting the people is a great part. And then the second part is you'll be able to meet people who might be involved in your team in the future for that Friday, 15th of March event. So strong suggestion there. We have an expert panel next week. Sign up to that one for the Newcastle John Hunter Hospital or the University of New England one, and you'll be able to actually meet people to get involved that way. But there's a lot of different skills, Prem, that entrepreneurs and investors will be able to bring that health professionals may not have and they're seeking. So that's a big part of these pre-events and networking. But great question. Thank you very much. Is this the first time the Innovation Challenge has occurred? This is the first Mental Health Innovation Challenge run by the Primary Health Network, Emma. Yes, thank you very much. Great question. I think in terms of the topics of why, I think Richard covered that really well, and you can see our website for more information on that too. And in terms of focusing the topic area as well, there's some great points listed on the website there. Do we have, next question comes from Rachel. Do you have a limit on the number of people that can attend the challenge? Do people need to have attended the pre-events to come to the challenge? In terms of the amount of people that can come to the Mental Health Innovation Challenge, we are capped in terms of how many teams can present just time-wise. We also capped a little bit in terms of the space aspects. But I don't see this being an issue, Sarah. So, Rachel. In terms of, do you have to attend the pre-event to come to the challenge? That has changed now, so you can come along to the challenge even if you haven't attended the pre-events. Please also note that if you're from Tamworth, in terms of covering your transport and accommodation, you will have to attend at the UNE's Idea Collider session. But again, it's a great way in terms of meeting your future team members and also practicing the problems. But most importantly, understanding the actual insights from industry experts who are facing these problems or actively solving them at these pre-events. Great question. Thank you, Rachel. Letitia, we have a question coming through. How are the ideas going to be ground truthed for appropriateness on ground, specifically in our at-risk rural communities? That's a fantastic question. I think the best answer I can give here is that this is a community-led innovation challenge. And so by involving as many people as we possibly can, in terms of finding the appropriateness, we'll be able to get as many stories, as many experiences and insights from different people with different backgrounds as possible. And that ultimately will make sure that's the most appropriate solutions as possible. But again, that will also be tested by industry experts. So the judges who will attend the actual innovation challenge and the mentors that will attend will come from a variety of backgrounds, a variety of experiences. And hopefully they can shed light in terms of your specific area that you've listed here, which is our at-risk rural communities. Great question there, Letitia. Thank you. Okay, our next question comes from Rachel. I live in Sydney, but could get to the Friday, Saturday event. Is that going to be useful to show my prototype app? Just clarifying this, get to the Friday, Saturday event. Is that going to be useful for my prototype app? I think, Rachel, it might be better to come along to one of the pre-events as well, particularly if you're in Sydney. Gosford's a close area for that one, and that idea collider is being held there. And that is a great way where you'll be able to show your prototype app and share that with different industry experts and different health professionals to get some feedback on that. And that might be able to inform your decision whether the trip up to Newcastle for that Friday, Saturday event is really worthwhile for your prototype app. So great question. Thank you very much. Samantha, great question here. Is there a minimum age to join the team? That is one that I actually am not sure of, and I'll have to come back to you on that. But that definitely should be on our frequently asked questions, and that's a great part for us to include. So thank you very much for that question. I don't have your answer there, but I will get that for you soon, and we'll put that on our FAQs. Jess, you've written the event. I can't remember your previous question, though. I might be able to find it if I look through answer just quickly. Usability and accessibility needs to be incorporated into this event. Yes, so for the actual event itself, the Health Innovation Living Lab at the John Hunter Hospital, I should double check this actually, but for the event, we'll update on our FAQs, whether that is being properly incorporated into for our event. Thank you very much, Jess, good question, but I will have to double check and I'll update our FAQs. Next question comes from Mark. Will the teams themselves retain all IP associated with the ideas submitted? That again is a great question. They'll be logged in dev posts and Slack channels. We have had discussions around this, and that's another question that I'll have to quickly put onto our FAQ website after a meeting with our team. But thank you, great question there. Will the teams themselves retain all IP associated with the ideas submitted? I'll just make sure of the answer there on the FAQs. Letitia, another question there. In relation to Jess's question, is there consideration of literacy and connectivity issues in the challenge? Again, that one might be something I'll have to come to the FAQs for, sorry. I'll talk to our organisers and managers and we'll be able to post that onto the FAQs. But thank you for the question. That's a great one for you, Letitia. We'll update that in regards to the accessibility and usability and also our literacy and connectivity issues. Thank you, Letitia. This question comes from my former colleague, Lauren. Will it be possible to attend the challenge event on the day as an observer, not a team or participant? Of course, Lauren, you can come along. I'd love to see you again. That'd be fantastic. Thank you very much for jumping on the call too. That's great to see you there. So yes, you can attend the events as a not as a participant, as an observer. Yes. Matthew Barry, outside of the scheduled events, are there any ways for potential challenge participants to network and discuss team formation prior to the challenge event? No. So you'll have the pre-events where you'll be meeting the same different types of people, but the actual team formation activities will all occur on that Friday 15th. The idea behind this is to not allow anyone to have a competitive advantage against the other teams. So that way for Saturday 16th, it's an even playing field. Great question. Thank you, Matthew. So outside of the scheduled events, are there any ways for potential challenge participants to network and discuss? The pre-events are fantastic feeder events for that, so you can network and you can discuss your different ideas, but the teams won't be formed until that Friday. Great question. Thank you, Matthew. Our next question comes from Tina. Our organisation is a statewide, not-for-profit mental health organisation, but providing programs and events across all of New South Wales. Would we be eligible to cover your PHN area as we provide services or events in your area at present, but not based there? Sorry, give me 2 seconds. I'll just read this one quickly. As we, I assume. . 'Cause Tina, I think according to the criteria, it was if a member was living or working in the area, which it sounds like it is in your case. But that again will be one that we'll double check with our team and add that to our FAQs for your specific question. At the moment, I'm going to give an indicative yes, and I'll double check that one for you. But thank you for your question. Our next question. Rachel, do you have strategies in place to encourage people with lived experience to be involved? That's a great point and great question, Rachel. Again, that's one that I'll have to double check with our team, and we'll be able to publish on the FAQs. I don't have an answer for you right here at the moment, but thank you. Very good question. Vanessa, how many people are we expecting to at the Tamworth event? That's a great question. That's actually held by the University of New England, and so they'll have different Eventbrite links and registers that I don't have access to. Yes, I won't be able to give you an update on that one. I think the best answer there is, Vanessa, go to the event, you'll be able to find out for yourself. That's fantastic. So it's on next week, and the Ideas Collide is a week earlier as well. I don't think that one will publish on FAQs. Or maybe we can. I'll double check with the team and we'll be able to discuss whether we're going to publish that. But thank you, great question. Thank you very much. Another question from Mark. In regard to a level playing field and judging, as you mentioned, I imagine there would be different expectations of what would be presented in the pitch between a group with a new idea that is less than 24 hours old and a team bringing a preconceived idea product along to the pitch. Yes, fantastic question, Mark. That's one that we'll clarify in the FAQs as well. But yes, it's exactly right in terms of what we need for this challenge is a level playing field for anyone that has a preconceived idea or a service that's currently running. So thank you very much, Mark, and that will be taken into consideration, and we'll make sure that's very clear on our FAQs before the challenge day. Next question comes from Philip. This is a broad concept reaching such an important subject. Great effort. Thank you very much, Philip. All these ideas will be lost if no funding is available to implement. Is this why you are inviting investors? Which poses, I assume, the problem of investment. Unless government pays, these ideas are usually not paid by the user. They will all require money to implement. Will there be funding available to challenge winners? I assume all the innovation IP ideas remain 100% owned by innovators. Is this correct? Philip, that's a fantastic question. I think I touched on that one a little bit before in terms of the IP. So for the IP question, we'll make sure that's up on our FAQs. I already have an idea of the answer now, but I want to make sure before I give you the full final answer there. Will there be funding to challenge winners? Again, I talked about the conversations that the teams had in the background about this, but at the moment, what we have the different accelerator programs at the University of Newcastle and the University of New England office. And that there have been conversations on for this, but otherwise the prize money, which is our $2,000 first prize, our $1,000 second place prize, our $500 highly commended prize. But the IP answer there, Philip, I'll go back on the FAQs and we'll have that updated for you very shortly. Thank you very much. Are there any other questions? This has been fantastic. We've had a lot of questions. It's been very engaging. What's nice to see too is there's a lot of positivity around the event, which is nice to see. I'll just wait an extra minute to see if there's any further questions. AC, I'm not sure that's the name that we have here. We have a question that says, can you join if you do not work or research in the field of mental health? I'm a chemistry PhD student and have dealt with mental health situations throughout my life. That's a fantastic question, AC, and we actively encourage you to participate in the challenge. It's not just, for instance, for health professionals, it's also for investors, it's also for entrepreneurs, tech experts, and also students and researchers. So we'd love for you to come along to the challenge. I think any insights that you can provide will be really interesting. And hopefully as well, you'll be able to learn from yourself and from other experts in the field there in one of the pre-events and at the challenge day. So great question. We actively encourage you to come along to all those events that you're able to. Starting with our expert panel, which starts next week. That's up in Newcastle. I have a question from Julie. Just wondering, as I live out of region, would I be better off waiting to see if our PHN does a challenge like this, or come along and hope to meet people to team up with? I can't really comment on your PHN, Julie, but I think in terms of the the amount of work and effort that goes into creating something like this and taking a risk in creating something like this is something that's very unique. And so I'd really encourage you to actively come along to this session from RPHN for the Hunter, New England and Central Coast. If not just to be able to participate in the challenge, but also to learn something from the industry experts of this area as well. I think you'll find a lot of value in that. Great question, Julie. Tina, are there guidelines to follow on the website for ideas for the challenge? We don't have those guidelines at the moment. At the moment, there's 3 different criteria. First is innovative, scalable, early intervention solutions. So that's what we're looking for in terms of our objectives, and they are listed on the website, Tina. I think that's as far as the guidelines will go, because we are looking for a broad range of different ideas. And that's generally the best way to try and solve a problem, particularly such a complex problem as mental health and the idea behind mental fitness. There will be a broad range of solutions that we'll be able to look at here. And really an important part is the process here, understanding what process goes into innovative thinking, design thinking, and creating these innovative networks. Thank you very much, Tina. We have another question from AC. Will a similar mental health innovation I2N event like this happen again in the future? Just to clarify, AC, this is an event run by the PHN, and the PHN has partnered with I2N and the University of New England as well. Will a similar mental health innovation event like this happen again in the future? We're uncertain, so it's always a good idea to come along and make sure you get the most value out of it while you can. But great question as well. Mark has had some fantastic questions. Mark, are you aware of other innovation challenges that have been run in the past in different domains? It might help people to wrap their head around the type of solutions that might get presented. Yes, so a lot of different universities run different innovation challenges, and they'll usually have a theme. So for instance, we might have a climate tech innovation challenge. In terms of the type of solutions that we're looking for, I think I can't really say too much about this because I'm not an expert in mental health. But at those pre-events, you'll get a better idea about what actual problems are people trying to solve and what solutions currently exist. So in terms of wrapping your head around, okay, what solutions should I look for to what would be good to present? I think attending those pre-events will give you a much clearer idea than I'll be able to provide you on this Zoom call. A fantastic question. I think that's also one we might add to the FAQs. Okay. That's been a lot of questions. We've been rolling through them. Thank you very much, Taylor, for organizing all our questions and organizing our Zoom calls and for posting them to the chat. Thank you very much, everyone else, for attending today's session. Once again, if you are a friend seeking support for your mental health, please call the amazing people at Lifeline on 131114. I very much look forward to meeting you at all the in-person events in the future. I'll just double check our last question here from Letitia. Great idea. How can we include the more rural and remote communities of the PHN area, which find it hard to reach the physical urban locations? That's a fantastic question. I think what's really good about this challenge and what the University of New England's organised in conjunction with the Primary Health Network is they've been able to offer transport and accommodation to be able to go to the events in Newcastle. And again, to be able to access that, Letitia, you'll be needing to attend the University of New England's Idea Collider. All those events will be found on our website. I think Taylor's also posted them all into the chat. But otherwise, that's just about all the questions that we have today. And thank you very much. I look forward to meeting you in person at the future events. Thank you very much.